Hi, this is Dr. Scott Hoar, and this is Treatment Tuesday, and this week we've got a special guest, Dr. David Strong, who is an emergency room physician at Boca Regional Hospital. The first thing I want to ask you is a little bit about your experience with chiropractic. What had you actually accept our invitation to be here today? Because many people look at something like an emergency room physician and chiropractic as conflicting oppositional maybe sources for people in their health. So what had you accept our offer to come here today for a treatment?
Well, my experience with chiropractors have always been excellent. It actually started with me back when I was in medical school. When I was in an accident, I was run off the road and I had to go to a chiropractor just for treatment. And ever since then, and this was when I was in medical school, so my foundation was, before I was a physician, I never had any ill inklings towards chiropractors at all. Not only did I get very good treatment, I'd still do some of those exercises to this day. So I think part of my training, if you will, was an early introduction to chiropractors, and it's always been good.
Would you say that collectively, if you could speak for medical physicians everywhere and ER docs, is there a particular perception of strengths or weaknesses maybe about chiropractic care and about your patients getting chiropractic care?
I think, Scott, it's me personally, like I said, I have a very good relationship with chiropractors and the treatment that they provide. I wouldn't say it's the most positive relationship, because I think some physicians, i.e. emergency physicians, think chiropractors are not real doctors because they didn't go to medical school. Chiropractic care, to me, deals with a lot of joints, a lot of muscle or pressure that I think we would never get to do, at least from the emergency department standpoint. Mm-hmm. At Boca Regional, actually, we have an urgent care. The emergency physician has an urgent care, and we refer a lot of patients post accidents or post any kind of muscle strains to chiropractors. So there's no negative connotation with us.
Awesome. Well, that's great to hear, and I'm glad things are that way. We've heard all sorts of things over the years of certain doctors are pro-chiropractic, some doctors are against chiropractic. People say, I don't believe in chiropractic, as if chiropractic is a religion versus, does it change people's function? Does it lower people's symptoms and actually have people feel better? So it's always an interesting thing. So I'm glad that you're here so we can talk about that sort of stuff. You personally, what are you dealing with as far as what you'd like to get treated today?
I've had a lot of arthritis in my life. I played a lot of basketball, played in high school, played in college. And I don't think I lifted weights the right way, and I think that's where a lot of my issues with my shoulders happen. I ended up eventually getting, obviously after college and medical school and everything, something called bilateral distal clavicle release, just because of the arthritis in my shoulders. Mm-hmm. So shoulder pain is a big deal to me, and if you know anything about trying to sleep or do anything, you're always using your shoulders, laying on your shoulder to try to go to sleep, and that was always an issue. Another issue I have is lower back pain, but that's just because of my weight. And the third issue would be I have foot pain, and I actually ended up having surgery for both of my feet. I had what we call a chelectomy on both sides. Mm-hmm. And I'm still having issues, but I think it's just because of a lot of arthritis I have in my body, period.
Sure, okay. Well, we'll certainly take a look at that stuff and see what we can do to help you out. Okay, so we did an initial movement assessment with Dr. Strong. What we saw was some limitations in his neck movement, certainly pain and restriction in his shoulder movement. And when we did things like bending over to touch your toes and leaning back, he had restriction in how his hips were moving. So we're going to take a look at all that stuff and see what we can do. He said the primary issue is the shoulders that he would really like some relief with. So we'll see what we can do here. All right, so I'm just going to kind of examine some of your musculature and some of your movement. I'm not doing any treatment yet. I'll let you know when we get to that point. So a big thing we're always talking about is neck movement, and when you have restriction in your neck movement, that adds more stress and kind of compensatory movement to your shoulders and your shoulder girdle. So one way we can impact shoulder, especially AC joint issues, is just making sure your neck is as flexible as possible. And so right now I'm looking at some of the musculature, David, around your neck, particularly your scalenes And we'll get to your SEM to see what's a little bit too tight that would be limiting your neck. How does it affect you these days? Like when was the last time you felt some significant discomfort in your shoulders?
After the surgeries, this one probably lasted, and look, these are both great surgeons. This one probably lasted, meaning this being pain-free, 2 or 3 years. And then, I mean, after any surgery, you're going to develop some arthritis. At least any orthopedic surgery, you're going to develop some arthritis. On an everyday basis, I have pain. It's according to what I do. I mean, I can't lift weights now. I can barely do a push-ups. And it's not because I'm not strong enough. It's just because it's so much pain to both of my shoulders. So I still get some electrical stimulation treatment to my shoulders, and it does help. But for the most part, I'm dealing with pain every day.
Okay.
And I would say probably the time where I experience it the most is when it wakes me up from sleep. It makes me feel like shit, actually, to be honest with you. Okay. Really, because I mean, I have sleep problems anyway, and part of my sleep problems, are secondary to my shoulders, but all I have to do is hit my foot the wrong way and it hurts. So any kind of movement, and no one's sleeping stationary for 8 straight hours, you're moving or whatever, it hurts. And not only does it hurt, the hurting is it wakes me up. So it's worse sleep. I got to get back to sleep. And someone already with a sleep problem, it sucks.
Yeah.
So.
Good. All right. Drop it. Very good. And now we get in there, and there's just a little bit more give. You feel what I'm talking about?
Yep.
All right. Any dizzy type
No.
symptoms from that? Good. Okay. So now what we'll do, now that the motion palpation is complete, I'll go in there and I'll start doing muscle tests.
Okay.
And what I'm looking for is motor dysfunction. Most of this stuff I'm looking for, I'm sure you're familiar with muscle testing, is your 4s, your 4+s, just subtle little weaknesses in the muscles that kind of tell me, hey, you might want to address this sort of thing as far as the chiropractic stuff. Okay, so the first thing I'm going to do, given your history, is we'll test out your coracobrachialis muscle. So make a fist. What I'm going to do is push your muscle into the table. Now, when I do these muscle tests, the goal is not to win. The goal is just to resist whatever pressure I put into it. Okay, so I'm pushing down. Don't let me go. And again, so that I would call that a little bit weak. Okay. So what I'd like to do, given majority of the nerve root innervation for coracobrachialis comes out of C6, is come in here and do another little neck adjustment right to the C6 area. And I want to see if we can get that muscle firing a little bit better.
All right.
Okay. So drop right there. Good. And then we'll go test that muscle again. Make a fist, pushing down, don't let me go. Good. And I think that was a little bit stronger.
I do think it's a little bit stronger.
All right, good. And that's what we're doing here. So next, let's put your thumb and your pinky together. Good. I'm going to pull those apart. Don't let me. Ready, go. Perfect. Very good. Now what I'm going to do is your elbow, I'll pull it out like that. Don't let me do that. Ready, go.
Okay.
Very strong. All right. All right, make a fist. I'm going to push down. Don't let me. Ready, go. That's really strong. Okay, now we'll test your pecs here. I'm going to push that way, and I'll stabilize your opposite hip. Don't let me do that. Go. Very good. And that way, don't let me do that. Ready, go. Awesome. Very, very strong. Right here, I'm going to push down. Don't let me. Go. Very good. Bend that elbow. Relax. We'll put your hand kind of behind your back. I'm going to pull your elbow forward. Don't let me. Go. Very strong. Good. All right, now we'll go in and just kind of feel for overall muscular tension as you flex your shoulder. A lot of things are firing really nicely, so that's good. Make a fist, pushing down, don't let me go. And that's definitely weak. Now, seeing that we already got C6, what I'm actually going to look at here is the AC joint itself. Good. Is this tender?
No. It used to be a lot tender, but no.
All right, so I'm gonna go give you a little bit of a manipulation right on that AC joint.
Okay.
Okay, to see if we can't turn that coracobrachialis muscle on. Good. Make a fist, pushing down, don't let me. Good.
Feel stronger.
Yeah. Well, that's really the point. The
Yeah.
manipulation, it stimulates the inhibitory effects of that area. So
Okay.
I mean, I basically describe it as a reset button
Okay.
for that joint. And then as soon as we're done with the chiropractic treatment, we're going to do exercises to start retraining your motor behavior, your muscle
Okay.
memory as far as how you control that. And that's really what makes the lasting difference here.
Gotcha. Exactly.
Your thumb and your pinky, pulling apart. Don't let me. Ready? Again. It's just a little bit weaker on that side, isn't it?
It is.
All right. So I'm going to look at your C8 and T1 nerve roots, which come out right around here. Drop your head. Good, and we'll do a little adjustment here. Very good. Thumb, pinky. Ready, go.
Man.
Better, yeah?
Fucking, I don't mean to swear, sorry about that. It's a lot stronger.
I'm going to pull your elbow out like that. Don't let me do that. Ready, go. Again. Okay, pretty good. Make a fist. I'm going to push down. Don't let me. Okay, so that's weaker on this side. So specifically, that was the serratus anterior. So relax that elbow for me. Good. And what I'm going to do is come right there. Okay, so deep breath. Breathe on out. Very good. Okay, make a fist. Pushing down, don't let me. Or rock solid. Right?
Yeah, exactly.
All right. Okay.
And I'm thinking you're going to be bullshitting, but every time we redo a test, it's stronger.
Yep. Hold it right there. Pushing out that way. Don't let me. Go. Good. Pushing that way. Don't let me go. Very good. Arm right here. Pushing down. Don't let me. Good. Bend that elbow. Put the hand behind the lower back. I'm going to pull your elbow forward. Don't let me go. And again. One more time. That's a little bit weak. So we're kind of looking at teres minor infraspinatus there. And I'm just going to get into some of the soft tissue stuff here. Same sort of deal, which is not surprising. Pec minor. And you know, pec minor, when you've got shoulder girdle dysfunction, pec minor is the one that loves really hunkering down and getting super stiff and tight. All right, so I'm going to do that same muscle test, which is just pushing forward. Don't let me. And yeah, the fact that it shifts your whole body. So that test's a little weak. So a lot of times that can signify a little bit of a posterior subluxation sort of thing of the shoulder. So what I'm going to do is I'll bring it back right here and give you a little thrust, okay? Okay, great. Put your hand right there. All right, I'm going to push forward with the elbow. Don't let me. Good. A little bit stronger. Very good. You can relax your arm. And I'm going to do a little bit of a motion palpation with your thoracic spine. We certainly have... Is that tender right there?
Oh, not really.
No? Well, it feels a little restricted to me. Good. So I'll give you a little thrust right here, okay? Very good. Still a little bit. We'll do a little bit of a manipulation here, okay? Good. Good. I like it. A little bit right here. Take a deep breath for me. Breathe on out. Good. Thoracolumbar junction here. That's a little stiff. Okay. Do me a favor, David. Would you bend both your knees at 90 degrees? Good. Relax. Pretty stiff in there. All right, deep breath. Breathe on out. Good. Okay, I'm going to start some lower body evaluation and muscle tests and stuff. Let me see how your hips are moving. A little bit stiff with that external rotation on that right hip. do some muscle tests, pushing down like that. Don't let me do that. Ready, go. Rock solid. Pushing down, don't let me, go. Again, that's just a little weaker, isn't it? All right, so let's do this. I'm gonna have you turn on your side, this side up. There we go.
Jeez.
And now, go face down. All right, same muscle test, don't let me. Ready, go. Rock solid, yeah?
Better.
Bring your knee up. Good, I'm gonna push your knee down into the table. Don't let me do that. Okay. Bring this knee up, pushing down into the table. Not so good. Okay. All right, good. Deep breath for me. Breathe on out. Very good. So raise your knee up. Good. I'm going to push down. Don't let me. Good. So now we actually have those glutes firing. Perfect. Let's flip you around on your back. So I'm just doing a little bit of capsular release right here. Let's see if we can get any improvement. A couple of degrees out of that would be good.
Anything will be good with my feet, truly.
Good. I want you to point and in, hold it right there. Pushing like that, don't let me go. And that's a little bit weak, okay?
Okay.
Pushing and out, hold it right there. I'm gonna push them right there. That's rock solid. Up and out, push them right there, don't let me. And that's rock solid. So really, just the plantar flexion with a little bit of inversion, hold it right there. And I'm gonna push. Yeah, and I'm not crazy about that, relax. So what I'm gonna do is I'm gonna do a little bit of an adjustment to your navicular here.
Scott, you're a basketball guy, right?
Yeah.
Who broke their navicular bone?
Broke their navicular bone? I mean, it would have. All right, so we'll do a little adjustment there. Good. Now we point and in, hold it right there, push them right there. And I like that. That's a little bit
That's a
more
lot
solid.
better.
Good. We'll do the same sort of tests over here. Up and in, hold it right there, push them right there, don't let me. Good. Pointing and in, hold it right there, push them right there, don't let me. And that's that same sort of weakness right there. Good. Because it's all about trying to get the speed into the manipulation without damaging, of course, or irritating any of your tissues. And there we go. I like that a whole lot more. Let's test pointing in, hold it right there, push them right there, don't let me. Still pretty weak, so we're gonna hit the navicular on this side as well. Good. Pointing in, hold it right there, push them right there. I like it, that's better. Up and out, hold it right there, push them right here. Rock solid, pointing and out, push them right there. That's very good. And flex. Good. And my fingers are going to be right over here, and I want you to press in. Yeah. That first exercise we did, you were doing an arm bar, that's what we call when you hold the kettlebell in one hand, and then you were flexing your shoulder. What was that like for you?
I mean, you could tell how weak some muscles are when you're not thinking about it. When you're just doing everyday life, you're just, you're lifting, pulling, whatever.
Yep.
When a certain muscle is singularly like attacked or when it's being evaluated, and literally that was a 15-pound bar, and you would think, okay, it's nothing. No, it was some wavering until you really stabilize that muscle. So I guess it was eye-opening.
Yeah. Did you notice when you held the weight that your movement actually improved with your shoulder?
I think it improved once you identified it. It would, like I said, in everyday life, you just don't think like that unless it's being singularly trying to be evaluated. But yes.
And when that's turned on, now your shoulder is able to restore more normal, more ideal, not perfect, but range of motion. We don't want you to strengthen that.
Okay.
That second exercise, we call it the armbar body roll, where you held the weight and then you turned your whole body. So you had the stabilizing force of your shoulder girdle, and then thoracic and really whole body rotation while continuing to stabilize. What was that like for you?
It sort of makes sense. It sort of ties in. I mean, I think it was good for me. It still makes me realize I need to probably, A, do more exercise like you recommended, but B, maybe I need to do some weight training. And that's always been a problem for me.
Yeah, we actually wholeheartedly believe that weight training is a great thing. A lot of people do it wrong, right? And they can do it to the point where it's actually injurious
That's
to their
probably what
bodies.
happened to me. Exactly.
But like we saw, we were using weights today, and they were there to really stabilize your body while encouraging good, healthy movement of full range of motion without hurting. Okay, David, so that was your treatment. How was that for you?
I mean, when you look at the pre and post, meaning your manipulation, it was stronger. And it wasn't me just BSing. It was legitimately stronger, and I could tell. So,
Yeah.
And I feel better.
Good. Was anything surprising today?
I was so weak in certain areas. But it also surprised me that any manipulation that you did, you certainly noticed, or at least I certainly noticed, more strength once a manipulation was done to try to relieve pressure or whatever you're trying to do. It helped.
Right. Good. Dr. Strong, thank you so much for coming on today and giving us an opportunity to see if there's anything we could do to help. If you want to see our next video, check out our next Treatment Tuesday next week. Don't forget to hit the subscribe button and leave a comment below. Thanks so much.